Welcome to this session, and thanks to the organizers for this opportunity to share our work with the esteemed gathering today. We have pulled in our experience to work with partners in over 100 countries in form of an open platform. On behalf of Catholic Relief Services and our partners in Iraq, Ankawa Humanitarian Committee, we welcome you to this webinar. CRS has developed a public-facing website. It is an interactive website and learning platform called the Institute for Capacity Strengthening. The purpose is to share our learning, tools, job aids, materials, reports, and intended audience includes CRS colleagues, our partners, peers, donors, and anyone who is interested in capacity strengthening of their organization. It is an open platform, accessible to all. One of such resource is the Institutional Strengthening Guide, or ISG in short. Since we work through and with the partners, it is pertinent that we build their capacity so that they serve the community as an agile and effective organization. Stronger systems and structures enable them to be responsible stewards of the society. To achieve this aim, this guide was developed. One of the chapters of this guide, which is chapter 2, is Hokai, and it is a tool as well as as part of the ISG. And Hokai stands for Holistic Organizational Capacity Assessment Instrument. Using this Hokai tool, CRS assists its partners to conduct a self-analysis of their strengths and challenges, develop an action plan, and improve through various capacity strengthening processes. Hokai examines 10 capacity areas that cover different aspects of an organization. The 10 areas are identity and governance, strategy and planning, general management, external relations and partnerships, sustainability, organizational learning, human resources management, financial and physical resources management, program services and result, and not the least one, gender equality and integration. So all these areas, they cover into the review of the organization. How we do that? We facilitate the exercise from a perspective of level of achievement on these parameters, which could be strong, which could be weak, needs improvement, and that categories, and the level of priority. And that is completely driven by the organization based on willingness and urgency. Each capacity area has sub areas that covers it in a holistic way. An example of this is the capacity area of strategy and planning that is further divided into governance, mission, vision, values, stakeholder participation, organizational constitution, organizational culture, organizational structure. A mixed group of partner staff reflect on these areas and explore where they stand as an agency. We now present this capacity strengthening cycle as the cycle represents such exercise is recommended at the beginning, midterm, and end line of the agreed timeline. It may be as per the project cycle, grant status, or sometimes as a partnership support. Now I invite Ms. Sogita Imad from our partner in Iraq, Ankawa Humanitarian Committee, where we conducted this Hokai assessment some time back, and to share her experience. Over to you, Sogita.
Thank you, Kushal. Thank you, everyone, for taking the time to listen to our experience. We as AHC are very happy to share our Hokai experience with you. I am Sogita, as Kushal mentioned, and I am the project coordinator of Strengthening the Ankawa Humanitarian Committee to Respond project. CRS Iraq and the Ankawa Humanitarian Committee are implementing a USAID-funded project called Transitional Assistance for Internally Displaced People in Iraq. which includes a significant capacity strengthening component. The objective of these capacity strengthening activities is to build the institutional capacities and strengthen the skills of the organization staff to enable them to receive and manage funds from public donors, including USAID. In fact, in addition to the TA project, AHC received another direct grant from USAID that complements the capacity strengthening activities under the TA project and allows us to prove that we are able to implement projects funded by public donors. To assess the current capacities of the organization, we used the full Hawkeye assessment tool. And because of COVID, we could not arrange meetings in person. So we had to conduct them online through Microsoft Teams. The online experience was challenging because it lacked human contact, but both CRS and AHC worked very hard on the positive sides of the experience while adapting to the context. The assessment consisted of a series of questions under 10 categories. AHC reflected on each statement based on its current situation and realities. And looking at the system we had or we didn't have in place, it required us to take the lead and in the reflection and on the experience, to be honest and transparent through the process and clearly identify AHC's reality. We trusted both the process and CRS to capture the reality of the organization. After this exercise that was conducted over several days, we had to let things sink in. We held internal meetings and discussed what AHC needs the most and worked jointly with CRS to identify the priority topics on which we wanted to work on, keeping in mind the recommendations of our donor. Some topics were obvious, like strengthening financial systems of the organization, and others were less obvious, like staff development. Then, we developed an action plan jointly with CRS colleagues team and kept the communication open between us to reflect on how to implement this action plan, how to adapt it to the context of our organization, our learning preferences, and our needs. The noticeable changes are finalized HR policies, such as recruitment and contracting policy, office norms, leaves and holidays, and of course, code of conduct. At the current time, we have reached the Hawkeye mid-assessment phase. AHC has accomplished so much in the past 8 months and is aware that the pathway we have taken is so long. We have developed policies for our operational departments, identified clear procedures, and we are now working to develop our proof of concept project with the support of CRS. We are looking forward to the midterm Hawkeye assessment to see these improvements and accomplishments we have achieved so far translated into numbers and facts, and to review our action plan or priorities according to the results. Thank you again for the time you have taken to listen to our experience, and over to you, Kushal.
Thank you so much, Sogita. It was nice to listen to your experiences. I now present some of the tips for success, especially when we have done this in a virtual mode. Need to have patience as well as space the activity for better reflection and assimilation. When we are doing this from a distance, it takes time to sink in. Everybody has to sit from a different distance, different locations, and they need to talk sometimes after the exercise or during the process is going on. So we need time to do that. This particular exercise, which Sogita just now explained, it took almost a month to understand and go through that process with short breaks and different series of events. During the event when we are doing, it is also important to have breaks in the sessions and mindful of the local cultural aspects. It could be prayers, it could be other things that is needed. It is more pertinent when it is done virtually. In any workshop or any discussion or reflection, there are some silent speakers or participants. We need to motivate them and ensure that everyone is participated. Otherwise, they are lost behind the curtains or behind the screen, and we don't know their presence. Even if they have a feeble opinion, that can be sometimes very crucial. We need to be prepared for the technological challenges and have backup plans. We used to share our PowerPoint presentations, documents with multiple people, so that in case of a failure, somebody else can put us up uh, and then make the presentation. Since there were some co-facilitators, it is important to have good understanding and collaboration among the co-facilitators so that it's a seamless experience for everybody. We do collect feedback, but then in virtual mode, collecting feedback is important, but it is also important to respond to them genuinely, because that is crucial and it helps them to understand. Just to wrap up, it was nice talking to you all and share our experiences. Do visit our website and write to us in case you have any questions, comments, or suggestions on this email ID. Thank you so much for this opportunity and look forward to your questions and answers. Thank you.
Good morning, good afternoon, depending on where you are. My name is Mariamu Amadi, and I'm with Food for the Hungry. I'm here with my colleague, Erin Pfeiffer, and we will be sharing about Food for the Hungry's Caregiver Mental Health Knowledge Sharing Series and Resources. The vision of Food for the Hungry to end all forms of human poverty worldwide includes working to understand the underlying causes of malnutrition and food insecurity. Over the past several years, FH has become actively involved in the intersection between caregiver mental health and nutrition outcomes, and has become increasingly engaged with food security and nutrition stakeholders who have an interest in how mental health affects caregiver well-being as well as child growth and development. While mental health is gaining global attention, Food for the Hungry identified the lack of collective platforms for exchange of knowledge, research, tools, and best practices related to caregiver mental health and its intersection with food security and nutrition. Thus, the Ideal Microgrant funded knowledge sharing series aimed to fill this gap with an innovative global community of practice that brings together researchers, implementers, policymakers, and funders who can collectively contribute to the advancement and effectiveness of food security initiatives globally. So maternal mental health and the mental health of other primary caregivers of young children is increasingly recognized globally as a critical component of women's well-being that has undeniable, long-lasting, or even permanent impact on her welfare, her family, and the health and development of her children. Global leaders are recognizing that holistic health and well-being cannot be achieved without addressing mental health, and that poor mental health may be a barrier to achieving optimal food and nutrition outcomes. Furthermore, the unforeseen COVID-19 global pandemic exposed and emphasized the need for attention and investment in both mental health and food insecurity and malnutrition, particularly in low-resource settings. It's estimated that at least 1 in 5 mothers in developing countries experience depression after childbirth, and 15 to 23% of children live with a parent suffering from mental illness. And despite high prevalence rates, mental health conditions are often under-recognized, infrequently measured, and are characterized by poor access to treatment options. Additionally, low and middle income countries include over 80% of the global population, but yet includes less than 20% of the world's mental health resources. So evidence suggests that mental health of caregivers impacts how they understand, respond to, and interact with children, which can have a profound impact on a child's development and future health. In low-income settings, maternal depression has been linked directly to low birth weights and undernutrition during the first year of life, as well as high rates of diarrhea diseases, incomplete immunization, and poor cognitive and emotional development in young children. There's growing evidence that these negative effects of maternal mental disorders on the growth and development of children are independent of the influence of poverty, malnutrition, and chronic social adversity. And with that, I will hand the mic over to my colleague, Erin, to talk about the Caregiver Mental Health Knowledge Sharing Series in more depth. Erin?
Thank you so much, Mariamu. My name is Erin Pfeiffer, and I served as one of the coordinators of the Caregiver Mental Health Knowledge Sharing Series. In light of the significance of caregiver mental health that was described, FH established a year-long knowledge sharing series in order to facilitate the exchange of knowledge, evidence, and resources, to promote integration of mental health interventions into global policy and programming, to drive future research and advance best practices, and to form collaborations and partnerships. The series was planned to be launched in mid-2020 and an in-person conference in Kigali. Due to the global pandemic, FH partnered with global learning partners to instead design a highly interactive, multilingual mini-series of 4 live sessions on October 20th and 27th, November 10th and 17th of 2020. These sessions focused on the importance and impact of caregiver mental health on food security, nutrition, and other development outcomes, implementation, research, and advocacy. The image here is a graphic that was drawn live by an illustrator during one of the first sessions. The virtual nature of the event allowed for a really broad spread of collaborators, presenters, and participants, perhaps even more so than if it had been live in Kigali. Over 200 unique individuals participated in one or more session of the mini-series launch, representing 60 different organizations in 28 countries. These icons show just a few of the entities who presented during or participated during the series. Following the launch of the knowledge sharing series in the fall of 2020, 3 task forces were formed by participants who were interested in working together to identify gaps in the resources and tools that were available to advance caregiver mental health in global development. These groups then selected one area of concentration to work on collaboratively. The 3 task forces, focusing on implementation, research, and advocacy, met monthly or bi-weekly to collaborate on their effort, and there were subgroup meetings in between. These working groups chose to develop resources and tools related to how to advance implementation, research, and advocacy, which could then be disseminated and utilized by the broader global health community. The final products were shared live in a webinar during that last month, and they were all these registrants and across the entire Caregiver Mental Health Knowledge Sharing Series network, which includes about 300 subscribers. We also shared it through the Global Mental Health Action Network, which includes about 1,200 members across 100 countries. I'll provide a brief overview of the resources that were developed, and you can access any of them yourself at the website here, caregivermentalhealth.org/resources. The advocacy task force members developed a position paper highlighting the evidence and importance of caregiver mental health in global development. This brief can be used as a tool to petition funders, decision makers, and government entities to integrate caregiver mental health into existing mechanisms. The group also documented 2 case studies of countries that have made great strides in prioritizing mental health nationally, Lebanon and Rwanda. The implementation working group collaborated to identify and concisely summarize examples of entities that have addressed caregiver mental health in sub-Saharan Africa. You can see the list here of case studies that were highlighted. The request for case studies was disseminated across a large number of networks and listservs, and a total of 15 case studies were documented, and along with links for contact information and supporting documents for readers to find out more. The task force aims to share these key findings with other implementing organizations as a means of informing and inspiring others to address the mental health of primary caretakers of children. One of the case studies that FH is leading that was highlighted here is the integration of Problem Management Plus into the commonly utilized behavior change approach care groups. PM Plus aims to help people improve the management of practical problems and common mental health problems, along with problem-solving counseling and methods for managing stress and other challenges. FH is actively working to pilot this integrated module in Uganda and in Guatemala. I would love to keep you updated on the progress of that. Lastly, the research task force decided to examine the impact of COVID-19 on caregiver mental health, and they compiled a rapid research review to understand the evidence to date on the relationship between caregiver mental health and COVID-19 pandemic, to understand any mediating and confounding factors such as food security and nutrition, parenting behaviors, and disability. This really ambitious group made a final product that has a lot of detail. And as I mentioned, each of these final products is available for download on our own website. COVID-19 certainly impacted this series and our work. The most significant challenge was certainly not being able to have the in-person launch in Rwanda. But from our previous experience in the US, having a knowledge sharing series here, we were looking forward to a really dynamic, interactive, multi-day workshop. However, despite this disappointment, the series collaborators really were able to pivot the in-person event to make it a very rich, highly dynamic mini-series with these 4 virtual meetings. And it did lead to a much wider participation and diversity of audience than we could have expected for an in-person event. The fact that nearly 200 individuals participated and across 28 countries really indicates the wide reach. Furthermore, the importance of mental health that was given during the global pandemic and the increased attention probably highlighted this topic more than we would have ever had before. The time is now to capitalize on the progress being made globally in mental health, food security, and nutrition. This grant-funded initiative made significant contributions towards empowering others and other relevant stakeholders with additional knowledge, skills, connections, and tools to make the first step towards ensuring complete physical, mental, and social well-being for individuals worldwide. We hope you will explore these resources and take a role in promoting mental health globally. Thank you.